Hi, welcome to If Your Meds Could Talk podcast. I'm Dr. Michelle White, your friendly, beautiful, and wise pharmacist and your drug pusher, also known as your drug dealer, the right kind anyway. So let me introduce myself. This is our first podcast, and I wanted to kind of give you an intro of what this podcast is going to entail. But first, I'd like to talk a little bit about myself. Tell a little bit about myself. I don't want to use too many I's, as you all understand, but I do want to let you know my credentialing to be able so that you can trust that I know what I know, and what I don't know, I'll make sure that I know before I tell you. So I don't say anything that is not trustworthy. It's not factual, or it's not truthful. I'm going to tell you the real deal, the good, the bad, and the ugly about medications, your health, and everything. So I hope you will stay tuned. I hope you will subscribe. But like I said, let me tell you a little bit about myself. Well, I am a native of Dayton, Ohio. And after leaving Dayton, Ohio, I actually pursued a college. I went to let me start over. I'm getting ahead of myself. So I left Ohio and I went to an all-girls school called Spelman College in Atlanta, Georgia. Woohoo! And the whole reason I wanted to leave is because I'm the only girl of 5 brothers. I'm the oldest as well. And I always felt like I was the little slave girl. So I was like, I'm leaving here. I'm going as far away as possible. And I wanted to be close to my grandmother. My grandmother lived in Georgia. So I decided to go to Spelman. And lo and behold, Spelman is an all-girls school. Didn't faze me at the time, but later on I said, wow, God, you got a sense of humor. I didn't grow up with any sisters, but now I got over 400 sisters. So a shout out to Spelman College, to all my Spelman sisters. So, well, I was in pre-med at Spelman, and I decided, okay, let's see how my grades going. And most of my colleagues, most of my sisters that graduated, and we got biology, chemistry degrees, biochem degrees. Some of them are dentists and some of them are doctors. Well, I'm actually the only pharmacist in my class. And I decided to do so because one summer I came home and I worked in a department store called Elder Bierman, for those who remember that are listening from Dayton, Ohio. And I worked and I met this pharmacist, and his name was Mr. Sloan. And Mr. Sloan was like, so tell me, what you doing? I said, well, I'm a pre-med major. He said, how your grades are? I was like, oh, they're okay. He was like, have you ever thought about pharmacy? I was like, nope. And he said, well, you should think about it. So I went back and I said, well, you know what? I think I will look into pharmacy. I always wanted to do pediatrics. And so I pursued a pharmacy career. And I applied to several schools, but the 2 schools that accepted me was University of Cincinnati and Mercer. Well, my mom missed me. And she was like, Michelle, why don't you come back home? And I was like, okay. So I came back, went to UC, University of Cincinnati, School of Pharmacy. And I stayed there for about 3 years. And I was like, this ain't working out. So I went back to Mercer, or I reapplied to Mercer and was accepted at Mercer. And that's where I graduated. Well, I worked at Grady Hospital for 4 years as a pharmacy student, and let me tell you, I worked at Walgreens while I was in Cincinnati on Seymour Avenue, and I worked in College Hill, and I worked on Lynn Street. So I was a pharmacy tech for 3 Walgreens pharmacies in Cincinnati, Ohio. I was hustling. I'm telling y'all, I was hustling. So anyway, getting back to working in the hospital, I worked for 4 years in the hospital. And in the hospital setting, and my colleagues or my pharmacy mentors was like, oh, Michelle, you don't want to do this. This is something. And Grady is one of the best experiences I've ever had. However, I decided, I didn't want to do retail and I didn't want to do hospitals. So at the time was the introduction of clinical pharmacy residencies. And so, and they did just like the doctors do their matching residency programs. Pharmacy was beginning to do the same. So I decided to do a clinical residency at the VA hospital. So that was my first experience. But again, I wanted to be a pediatric clinical pharmacist. And at the time, you had to do a general clinical residency first and then do a specialty residency, which was pediatrics. So I did my time at the VA. I did 2 months at Rainbow's Babies and Children's in Cleveland, and that's what hit me. I was like, yes, this is what I want to do. So I pursued all 8 pediatric specialty residencies in the United States at the time. And I was accepted at Miami Children's in Miami, Florida. And I did my year there. And then I was pursued by Mercer University and Emory University because at the time there was only one pediatric clinical pharmacist in Atlanta, Georgia. And she was overwhelmed. So I took the position. I became an assistant professor at Mercer. I had my own clinical site at Hugh Spalding Children's Hospital. Well, first it was Grady Hospital, and then we developed the 3rd children's hospital in Atlanta, which was called Hugh Spalding. CHOA now owns Hugh Spalding, so now it's owned by Children's Hospital of Atlanta, and so now they own it. And I did that for 7 years. I did a lot. And then I actually was able to have my own resident. I had a residency program for a few years in that 7 years. So after that, again, this was a contractual agreement between three institutions. That was Emory, Mercer, and Grady. Well, you know, sometimes contractual agreements starts wavering and all this. And they was like, oh, well, I decided to move on to public health, and I became the assistant director of pharmacy for Georgia Department of Georgia Public Health. And as I did that, that was amazing, because at the time, I didn't realize nurses could diagnose, prescribe, and dispense medications. And under the nurse protocol law in Georgia, they could do that in the public health setting or in the health department settings. So I was in a position to develop policies and procedures at this time. And I'm a think outside the box person. And fortunately, my director at the time was open to new ideas and new things. So she gave me the ability to be able to create policies and procedures that are still being utilized in the state of Georgia as we speak. So I did that for 3 years, coming up on 9/11. And that summer, I decided to leave and pursue something else. And I became the entrepreneurial part of me. That side of me came out. I'm like, okay, you can do your own thing. It was just before 9/11. I was supposed to head up the bioterrorism, biological warfare. I was supposed to head that up, and I was like, everybody has silos in Georgia. This is going to be an undertaking. And so I quit. I resigned and actually was able to work for Medicaid. I got a contract with Medicaid. I got a contract with the school health nursing. And I did that for about 4 to 5 years. And then in the midst of that, I ended up working at a rural hospital, which I worked from 2003 up until 2017. So I kind of have my hands in a little bit of everything. And everything, when I mean everything, I've owned my own pharmacy and a mental health facility. I enjoyed that because I got to understand how psych drugs work, how mental health patients are. I served the homeless population as well as those that the private sector of the mental health population, and my compassion came even greater for those individuals. During the same time, I was the director of a mental health clinic overseeing 5 clinics in Atlanta, Georgia. And as a result of that, was able to bring into those facilities medications that was well needed for those that were indigent and couldn't afford those high-priced medications, especially the newer antipsychotics that came out. And I remember when Zyprexa came out, and that was a great medications for psychiatric patients or those who had schizophrenia. So I've done a little bit of everything, and guess what? After those contracts ended, I ended up working for the pharmaceutical company or the industry. And I was like, oh yes, I could do this. I could do this. I could do this. And let me say this, I choose and pick who I want to work for because I have to believe in the drug. I have to believe that it's a good drug and it's going to benefit the patient. So the first pharmaceutical position I took as a medical science liaison. And the medical science liaison is just that liaison person between the physician, the hospital or academic institution, and the pharmaceutical company. And we deliver scientific information so that doctors will be abreast of what's going on. Also, if they want to do research with our drug. I was that facilitator, that in between, that mouthpiece for the pharmaceutical company to talk to those individuals about our drugs. So the first drug, which I think is still fascinating, was a device and a gas, and it was nitric oxide, not nitrous oxide, nitric oxide. And that was a gas for infants or peds. And guess what? I get to talk back to my my residents and everything. I was in heaven. I was in hog heaven when I got the position. But anyway, it was for pulmonary hypertension in infants and neonates. And so I enjoyed that. That was a contractual position, but it led me to go into the pain industry or the pain products. And my next 2 positions or 3 positions, I was the specialized or got experience being the medical science liaison in the therapeutic area of pain. So I've actually launched 1, 2, 3 patches, topical patches for pain. And I've enjoyed that as well. So now, let's speed up a little bit. So where am I today? Well, I'm a consultant for the health department again. I'm back in public health. I'm doing some telepharmacy type of work, and it's been exciting to be able to do that. I'm also a caregiver of my dad, was the caregiver of my mom, and having the pharmacy background that I have has afforded me to really take care of them. One of the doctors that came to the house said, "You got your own nursing home running up in here." And I was like, yeah. And we may talk about that, but that might be another podcast about care equals giving. You hear me? Care equals giving. So that's me in a nutshell. And I hope that you'll tune in. We're going to be talking about, first of all, let me say this. I'm going to start the podcast off with talking about every vital organ in your body. And we're going to start with the brain. We're going to start from the brain, from the head to the toes. And we're going to talk about all the vital organs first. That's my first few episodes are just going to cover your body. Then the second part of these episodes is going to go into detail. I'm going to have some guests come on that are special. They're specialized in their field, respiratory care, to talk about your lungs, and especially currently with the coronavirus, we're going to talk about your lungs, how your lungs are affected, what you need to look out if you have coronavirus or you think you have symptoms. We're going to have a guest come in. We're going to talk about your spirit, your soul, and your body as far as how that all plays into. So I'll have another guest for that. We're going to talk about some alternative medications, some alternative nutrition. We're going to talk about a gamut of everything because I believe you need to take your health back. And you shouldn't be taking a pill for everything. And a pill should not be taken long-term, period. Because God created our bodies to heal themselves. You hear me? He created our bodies to heal itself. So, once again, this is Michelle, Dr. Michelle White, your friendly pharmacist, wise, beautiful, and extraordinaire pharmacy. Drug pusher, drug dealer, the right kind. So subscribe, come back, listen, and I think you're going to be enlightened. And again, my whole passion and goal is to get you off these meds and get you to a better healthy body, healthy mindset, healthy living, healthy spirit. And that's it, y'all. Bye-bye.